people who wish to date of all sorts of ages in relation to COVID-19? Are there any rules and regulations? Relationships?
Relationships,
I'm not
yes.
talking about stable relationships.
No, I mean,
I'm just speaking about new relationships.
Yeah, I mean, we have to be a bit realistic, okay? I mean, COVID is not the end of the world. It is at the end of the day, a cold amongst young people. It is probably not that dangerous. So, I mean, heaven forbid, we put people off dating and having encounters and boy meeting girl, boy meeting boy, whatever, you know. But it would be very sad if dating were to stop. Dating never stopped, not even during the worst wars or during the worst epidemic. So yes, the people, I think life should go on as normal over there. As usual, the problem is if you have multiple partners. So you have multiple partners during a big party, and you've got a mass party or a mass event. But that, I mean, it's not really dating. That's like not knowing what's happening. Then you're at a high risk. Yeah. And it's the same applies for, say, cervical cancer or HPV. And the big problem is not if you have HPV, but if you have multiple partners, you're getting repeatedly infected. Because one fine day, you're going to find a variant that is going to affect you badly. But otherwise, you have to be realistic.
Coming back to COVID and an update, we've had a lot of news this week. Can you give us an update, please?
So firstly, I have to say, the big issue, of course, is the opening of schools. And I have to say, as I said last week, I'm totally in favor of the schools opening. So we cannot carry on with our children suffering and not going to schools for the children's sake more than anything else. Because
you said that last week.
But I've had a lot of messages, right?
Yes.
Where people are telling me, listen, we want to go to work, you know, what are we going to do with our children? So of course, I sympathize with women needing to go to work. I sympathize with men needing to go to work. I sympathize with people being able to keep their children at home. But first and foremost, is the children's development, as Owen Bonici said quite rightly in a column in The Independent. The children's development is being affected because children are social animals. They need to socialize with each other. They need to mix with their peers. They need to grow up with their peers. And they need to form bonds which are outside family bonds, which are tribal bonds, you see. And of course, they need to be educated. So these are very important. You can't just get all this off a Zoom or off online. So it's important that schools open and that precautions are taken. Now, what we have here is a situation where we've got the Department of Health on its own, and the Minister Owen Bonici, who I salute from here, who's taking a lot of flack. I have to admit, it's taking a lot of undeserved flack because it is a European decision for the schools to open, after all, and we have a number of schools doing their best to be secure. There is not one single, the schools have been criticized because there's not one single plan, not one single protocol. There seems to be various protocols between various schools, church schools, government schools, whatever. And the issue is that we have I don't know if there's a technical problem going on right now. Yes. Okay, sorry, excuse me, okay. There seems to have been a technical problem, so I apologize. So the issue is and I heard an interview from the NUHM official this morning saying, listen, there should be a single protocol. Well, not necessarily so, because this is new ground, new territory, and we don't really know what the best protocol is, let's face it. So we're going to be having to take some element of risk. This is choosing between two bad situations, between a rock and a hard surface. And we're between a rock and a hard surface, so we have to see which protocols work best. Schools have to start, and then with time, with experience, we will know which protocols work best. Now, we've had the south of England, for example, experience was very different to Scotland. In Scotland, the schools are opening, and they're doing very well. South of England, some of them had to close after 2 to 4 weeks. But even if you look at France, for example, you had 22 schools closed after a few weeks, but the majority are still going and doing very well. So I think with as time passes, we gain more experience with this novel disease, it's still called a novel disease, then we will be able to proceed. Okay, we're a bit dismayed to have seen an increase in cases right now, but on the other hand, I can understand that from a children's point of view, all these hundreds of children need to get back to their institutions to some level of normality so that they can carry on developing normally psychologically, normally physically, and so on. So this is from the vaccine point of view, if you'll allow me to talk about vaccine point of view, there's been a lot of alarm because the vaccine that we have chosen had the trial suspended for a short while because of one single complication that arose in one test patient and what's called a phase 3. Now, phase 3 have got tens of thousands of patients who are being tested with the Oxford virus that we invested in, which should be ready in December. The case was one of a very rare form of spinal meningitis that's normally associated with people who are in a very debilitated condition. Either they've been living a very tough life or they're malnourished or whatever. I don't know the exact details, but it's not unusual to have one single person present with a bizarre event which might or might not be related to the vaccine. You know, we've seen this with other vaccines, for example, with other viruses. One particular vaccine, swine flu vaccine, had what's called narcolepsy. People were sleeping off. But the virus itself was making people sleeping off, not the vaccine itself. So at the end of the day, with a vaccine that's being rapidly developed for what is a national emergency, and we have quotes here from various people, then certainly the side effect is not going to be anywhere near the risk undertaken with the virus itself. I doubt that vaccines have anywhere near that risk. We are in a public health emergency, right? So this puts the record straight for vaccines. Are we right in producing them fast? I say yes, because nowadays technology that is behind all these vaccines enable us to produce a vaccine much faster than usual.
That's very, very interesting to know.
Update.
We're joined by Dr. Ron Daniels, who's a consultant in intensive care, NHS Birmingham. Good evening, Dr. Daniels. Thank you for joining us.
Good evening.
I'm with Professor Brincat. You've been on TV together already a few times. Just an update from you. I know we're coming towards World Sepsis Day, and perhaps an update of where we are with that.
Well, and I think the professor has touched on this already. We have to take COVID-19 very seriously. This is and has been a horrific journey, and a reminder to health professionals and the public and policymakers of the threat of infectious disease. But I think we also need context, and we need to make sure that we don't take policy decisions that only prioritise people with COVID-19. We remember, as World Sepsis Day approaches, that COVID-19 thus far has taken an horrific 888,000 lives worldwide, but every single year, sepsis, normally as a consequence of straightforward bacterial infection, claims 11 million lives every year worldwide. So this is about a focus on infectious disease, but being mindful that actually there are far more common and deadly conditions out there every single year.
That's really very much is nearly what you've been saying.
Well, yes, I'm glad. Yeah, obviously. We have, well, I'd like Dr. Dennis to carry on because he touched on very important points. We've had a resurgence in Malta here of syphilis, for example, which in my day we did not used to study. You know, basically, it had become extinct. And I was a student at King's College in London, so we did not study syphilis. And then suddenly, or TB for that matter, TB had been consigned to history books when I was a student, so you can imagine it's quite a while ago, 40 years ago. Now today we are facing resistant TB, antibiotic-resistant TB, and this is causing a problem. And we can get cocky about certain diseases and say, okay, well, syphilis and gonorrhea are old-fashioned now. We're all interested in HIV. But you know, at the end of the day, HIV is with us. But chlamydia, from an obstetric gynecologist point of view, is much more serious in a way, because chlamydia will damage your tubes, and we call it a leading cause of PID and infertility, apart from chronic disease. Yeah. So yes, there are other organisms. I am happy, and I'd like to hear Dr. Daniels' comments on this, that the research, the amount of money spent on COVID will have spin-offs, various spin-offs on various other diseases. And I'd like to hear comments on what sort of spin-offs do you see coming off from research that has been carried out on COVID in just 9 months. An amazing amount of papers.
Well, it really has, and it's been fantastic. And of course, with that volume of research has occasionally come a reduction in the quality of the research, but we've learned some really important lessons about COVID-19, about its epidemiology, about therapeutic strategies. And that now needs to be applied across the infective disease landscape. We need not only research on therapeutics and what's effective. We need research into systems design, a system that is well engineered to respond well to normal infections, will respond well to a pandemic, as well as we need better data. We need data that doesn't just focus on a few pathogens. We need data that focuses on a broad range of infectious agents, but also around the body's response and the recovery from infectious disease.
And Dr. Daniels, just to close for today, can you give us some highlights about what you've got in mind for World Sepsis Day this year?
Well, of course, every year we encourage. World Sepsis Day is about basal activity. This is about individual health professionals, individual hospitals, policymakers, members of the public, just reminding each other of the importance of sepsis, what they can do. Because the beauty, if there is a beauty of sepsis, is that outcomes can be improved just through communication and information. This is about early identification. But what we've been doing this World Sepsis Day, particularly with work with the World Health Organization, Dr. Tedros today was tweeting about the importance of sepsis. There was a press release and a global action plan and a call to action around sepsis from the World Health Organization. And it reminds us that 1 in 5 deaths worldwide is caused by sepsis as the syndromic response to infection. And that's hugely important. And what we need is policymakers in every country to take this seriously now.
Thank you very much for your input once again, Dr. Daniels. Have a lovely evening. Thank you.
Thank you.
To close,
yes. Very often
Professor
sepsis,
Brincat.
as you know, is end stage of somebody who's very ill, very unwell. Somebody with, say, cachexia or cancer, end-stage cancer, they succumb to a pneumonia, of course. This is
and quite a lot of COVID-19
Yes.
Patients
Yes.
Also contract sepsis.
We can have always, we've got the spectre of secondary infection. A secondary infection is like mycoplasma in the case of COVID, which is a chest infection. COVID is interesting because it's a multisystemic problem. It causes various problems like thrombosis in various other organs. And we don't know what a cure means. We don't know if you can secrete it again. As you know, we've had a case today of a reinfection, or is it a resurgence of an old infection?
Sure.
We know the coronavirus can stay in your brain for a very, very long time, not necessarily causing any harm, like HPV, for example. As an aside, the HPV vaccine, which has a diminished incidence of HPV, has led to a reduction in incidence of premature labor, for example, because there are all these other benefits that one can get from say, vaccination. So vaccination is a very powerful tool. Sepsis is obviously worse when our immune system is rock bottom. So you've got COVID attacking your immune system, then you're laying the door open for a secondary infection to come.
Absolutely.
Or antibiotics. You kill one organism, you lay in a vaginal infection, for example, and you're laying the door open for fungal infections to turn up. You see, so it's always a balance when you're treating infections, because we have got our own natural what's called microbiome. We've got bacteria that live quite happily in our gut, but are pathological if they're in our bladder, for example. You see, when it comes to COVID, this is why COVID is interesting, because our immune system is still getting used to it. We know that the second wave, although there's been large numbers, has not been mirrored by hospital admissions so far. But now we've got the elderly being affected, and we've got to wait and see. But it's not just this. Just think of the economic impact. Maltese now cannot travel to several countries. We have to undergo quarantine. Some countries reject us. We can't go into Cyprus, for example. So there's more to it than just
Yes.
the physical aspect.
Yes, it affects us in many ways.
This is why children now have to be protected. They have to be. We have to think of sending them in, but you know, we need to see more impact from the public health sector into the schools.
Sure. I'd like
This is
to
not just an educational
close.
situation alone.
I'd like to close today with a message from you to mothers, grandmothers, grandparents, fathers, parents about children returning to school. You've been inundated with questions and comments, and so have I. So people are concerned.
First and foremost, schools are important for the children's development. And children need to go to school for their own sake. As a corollary, because our system is such, you know, parents need children to go to school because they need to go to work. So it is, and I've been advocating this for a long time. We need a system that cushions parents and children, that allows parents to go to school, that allows parents to go to work happily, without being constantly worried about their children being at school or coming home early, coming home to no lunch, having to wait behind the door and something like that. We need a cushion. Of course, the Israelis have perfected it, for example. We have perfected it. I keep on saying that our school day is too short, but we do need more activities for our children, more outdoor activities, especially more sports, more training, and discussion. The two things need to be different. Work requirements should be different to schooling requirements. Not to send your children to school because I need to go to work. It is a reality,
I have to say,
it's a reality.
that is quite a big problem.
It is a big problem. It's a reality. And this is why we need to come out. I'm not criticizing the parents who do this. I'm just saying we need to work out a system whereby a woman can fulfill her work requirements, her career aspirations, and a man can do that as well, because a man is equally responsible without having to worry about her children's schooling. Her children's schooling has got to be carried out very efficiently, and we do need to have a good, nice family relationship at the end of the day, but a sufficient cushion of some form of organization, some form of activities, some form of timetabling that keeps the children's requirements first and foremost, so they get a proper, very good, best education we can offer, because that's their future, whilst at the same time giving the woman and also the man the ability to fulfill their career obligations and aspirations without being constantly worried.
And some advice for people who send their children to school when they have simple colds and slight fevers, if you could kindly pass that on.
The reality is there are some parents who are vulnerable, and this is going to be a problem. The reality also is that there are some children who are also vulnerable, and this is going to be a problem. So depending on the protocols of the local school, then we have to see how to adapt in these sort of situations. But certainly, right now, this is where the cushion that I'm talking about comes into. If a parent has a child who has a cold and she has to go to work, what is she going to do? This is a serious problem. It's very easy for us to sit here and say, listen, if they've got a cold, a sniffle, they're not feeling well, do not send them to school. But there has to be a system whereby somebody actually looks after the children. Quite clearly, it cannot be the grandmother, because she's vulnerable, you see. So I think.
But I don't think the school should be responsible for that.
Well, it's not the school, but certainly the government and the social service.
Yes,
we need to set up this sort of system. Is it the Department of Education? Is it public health? Right now, the Department of Education is bearing the brunt. Public health, I don't want to cast aspersions on public health not being involved, but there has to be some sort of cushion, because a lot of children are being sent to school with colds, sniffles, and so on, because the parents need to go to work.
Thank you.
And not everybody has a grandmother, and people are having children later on in life, so the grandmothers tend to be older nowadays than they've ever been. So we need to come up with a system.
Thank you very much. As always, thank you, Professor Brincat. I'd like to thank you for watching today, to thank Professor Brincat, Dr. Ron Daniels, Chandra, and also Her Excellency Marie-Louise Colero-Preca. I thank you. I'll see you next week on Wednesday, not Friday, same time, and I wish you a lovely weekend.